Kia ora. I'm Janeve Green, currently enrolled in ASD. This is the presentation that has resulted from the interviews carried out by the people involved in the ASD paper. You have in front of you a very complicated concept map, and you may be wondering why this is so. The reason for this is that autism is a very complicated disorder. You may have heard of Temple Grandin, the woman who has high-functioning autism, advocate of animal welfare reforms and autism rights, professor, author, and regarded as in the top 100 of the most influential in the world. She said that ASD is a disorder of huge variables. Children between the ages of 5 to 10 years are even more variable. They are going to vary from very high functioning, capable of doing normal schoolwork, to non-verbal, who have all kinds of neurological problems. As a result of this, our task was not an easy one for this assignment. To come up with just one specialist was not going to happen. There will be time for any questions at the end, because quite honestly, I can't stop while this masterpiece is playing. The day service caters for adults over 21 years old. Specialist outreach teachers were previously known as the Special Education Itinerant Service and provide an itinerating service for those children receiving AWS. And IDEA services, meaning Intellectual Disability Empowerment and Action, is a service that works with many types of individual disabilities to help to make life goals achievable. As you can see from the light green box in the middle, the various specialists drew from a multitude of codes of ethics. All codes are based upon the key ethical principles. In the interview that I did with an autism field worker, she did not have a code that she worked from, as she'd never even considered it. There were many different challenges that were discussed, and interestingly enough, an educational psychologist mentioned that he or she used the ethical response cycle, which we are all familiar with, as their first port of call. All interviews mentioned the importance of reflecting upon their work in terms of the Treaty of Waitangi. Eva's interview with the person who worked with adults was particularly interesting, as she noted that she did not see those that she was working with as having a disability, so her main objective in the day was to have her staff treat those at the centre with responsible care and respect. She sounded the sort of person that would live and breathe ethical responsibilities. All that was spoken to emphasised the need for reflective practice. When working with those with ASD, the decisions need to be made on the spot, and sometimes things have gone better with the benefit of hindsight. Formalised reflection is done by RTLB and Special Ed Ministry of Education workers through supervision. At Special Ed, they are fortunate to have a kaitakawainga who is responsible for advice and guidance on local Māori protocol in tikanga Māori. One of the major issues that more than one interview highlighted was the importance of gaining permission from the whānau to share information. With ASD, there is often very sensitive information, and we need to be mindful that in some cultures the view to making this type of information known is not done. The answers around ethical and reflective practice as regards the Treaty of Waitangi were varied. We saw value in the issues of ASD as pertaining to the treaty, and knowledge varied from, "Oh, I always take my shoes off and have done a course on it," to "underpins all the work that I do." Jill Bevan-Brown conducted a study which involved the whānau of 19 children with ASD, and she found in all but 2 whānau a cultural input was desirable. A real desire to be listened to was also expressed, and this was also a common thread throughout all the interviews that we did. An interesting answer to a question around cultural responsiveness came from an interview done by Colin with an Ed Psych. He said, "Being culturally responsive, I feel personally, is a lot more complex than I think we are willing to admit. Cultural responsiveness within practice requires a practitioner to stop and reflect on the cultural aspect of the cases that they are involved in, and it involves using reflective processes, looking at how your own culture influences the way you practice, and identifying areas that need to be adjusted if necessary. When we reflect upon these thoughts in terms of ASD, it is the ASD guidelines that reminds us of how little research in the area around Māori with ASD has been done. I mentioned before the research done by Jill Bevan-Brown, and this is just about it. The parallel between hers and that done by Mandel and Novak are easy to note, that of geographical isolation being a major factor in lack of diagnosis and support. Another point brought up by Kelvin, who interviewed an RTLB with a vast amount of experience with ASD, was that never to assume that just because the child with ASD is Māori, they will want their child to participate in all cultural aspects. With ASD, this is not always possible and may not be in the best interests of the child to push. The area of resources was also touched upon by a speech-language therapist. She has modified the SCIRTS, Social Communication, Emotional Regulation and Transactional Support Program, to work for use in New Zealand. This program, which is designed to improve the overall quality of life through regulation and communication, is tailored to the needs of the child. She also took a language screening tool and converted it into Māori after consulting with local iwi. Interviewees worked with so many different cultures. Often schools rush in and know what's best, but they are viewing the disability from a white New Zealand middle class mindset. ASD has many different faces, and it was noted that professionals need to do their homework before meeting with parents and whānau groups. All were overwhelmingly in favour of inclusive education for children with ASD. My interview with the autism field worker, who incidentally has a son with Asperger's, felt for those who are high functioning, a classroom could be a rewarding place, but for those who are not, she wasn't so sure. In order to make schooling successful, it is important that the environments and curriculum are modified, according to a study done by Goldberg. Often, the attitude of teachers, parents and principals can be negative because of the unpredictable nature, and ASD and coping with behaviours that are challenging can be time-consuming and disruptive to other children's learning. The learning theorists that were identified all came from the constructivist social development models, which make links to the characteristics that are part of the traits associated with the main choices of interventions around ASD, that of the person's ability to react with the environment through socialisation, cognition and communication. It is stated in the ASD guidelines that it is essential that all dealings with those who have this disability has the family at the centre, and it was refreshing to note that all interviews also expressed this desire. Unity amongst service providers, who then contributed along with whānau to individual education plans and individual vocation plans, was regarded as the normal pathway. The two models that were expressed were those of a multidisciplinary, in the case of a speech-language therapist, and the more popular model of transdisciplinary. The benefits, as highlighted by Westling and Fox, of the later model is obvious for those with ASD, and as is noted by the comment in the slide that you see. In my interview, she shared that often there were many agencies involved and the information can be pretty overwhelming for families, and it can be better to build a relationship with only one or two people who can share the information of the others. The ASD guide informs us that there was no clear pathway for assessment, but a multidisciplinary approach needs to be taken, but as highlighted both in the guidelines and by many of those interviewed, early diagnosis gives better long-term outcomes through targeted interventions. My field worker expressed how difficult it was for her and her son, and the cost, distance she had to travel for appointments, all had a great impact on family, budget and life, which was exactly the barriers that Bevan Brown and Mandel and Novak highlighted in their studies. There was a universal agreement that evidence-based interventions that were based upon strengths rather than deficits were of the most benefit. The slide that you are seeing, I thought, highlights the grief that many parents feel once their child has been diagnosed, and the responsibility that professionals have to provide the best pathways for lifelong engagement. ASD guidelines tell us that communication goals should be in every plan, and the interview results around this domain certainly highlighted this area of importance and the need to be flexible in our dealings with those with ASD. ASD, as you have just heard, is a different way of thinking. And I would like to leave you with this thought from Hans Asperger, who observed back in 1938, not everything that steps out of line and thus abnormal must necessarily be inferior.